Anila is a wonderful medical educator, and she's not new to the GlomCon program. She has been an instrumental part of the GlomCon Fellowship Program.
Um, Hello, everybody, and thank you so much, Dr. Caza, for that introduction. You've been very kind in saying things, and I'm very happy about it. I've chosen this topic because I feel that it's a little different from what we read in textbooks, and this is a part of pathology which sort of I feel is underrepresented. So I've just chosen cases that we see in our day-to-day practice, and I hope it will be interesting for you. So without wasting any more time, let's just go to the first case. So the tropics, the tropical countries, it lies on either side of the equator between the Tropic of Cancer and the Tropic of Capricorn. And it accounts for nearly 40% of the Earth's landmass. And around 78 countries are either completely or partially within this zone. As of now, 40% of the world's population live in the tropical countries, and it's expected by the year 2050, 60% of the world's population would be living in this zone. We should also remember that 2/3 of the world's biodiversity also resides in the tropical region. So it's a very active region that we have here. I'm right now at the southernmost tip of the Indian peninsula, closer to the East Coast, right there. And most of my cases that I'm going to discuss are going to be from this geographical location. So what makes India unique? It's a partially tropical country with the lower half lying below the Tropic of Cancer. We have a unique climate, which is called a typical monsoon climate, where we have very high temperatures throughout the year. We don't have 4 seasons. Instead, we have just two, a dry season and a wet season. The temperature throughout the year is hot and humid, and there isn't much of variation in the temperature between December and Jan and in June and July. It's almost equal across throughout the year. The great Indian monsoon plays a very important role in our climate, and it brings heavy rainfall during specific months. Along with it, it has its own issues that we will come across in the due course. There is a diverse ecosystem here with more than 45,000 plants and 91,000 animal species that again makes certain unique medical conditions that we would be seeing soon. So kidney injury in tropical countries can be caused by unique factors that differ from those in temperate regions, and I've classified them under these 5 categories. It could be infections, certain animal toxins, plant toxins, traditional medicines, and environmental factors. So going to the infections causing kidney injury, this is definitely not the complete list, but I have just mentioned the common ones or the more important ones which frequently involve the cause kidney injury. It could be bacterial, viral, or parasitic infections. So the first case is of a patient who's 36-year-old male who's been having low-grade fever, loss of appetite, and loss of weight for 6 months, who developed pedal edema 3 weeks back. He didn't have any lymphadenopathy or organomegaly. On evaluation, he had pancytopenia. His creatinine was 1.9. He had proteinuria, and he was tested positive for HIV. His chest X-ray was normal. Ultrasound showed renomegaly. A kidney biopsy was done. On the left, the entire renal parenchyma has completely been destroyed by this very granular appearing necrotic material. Only the glomerulus is spared. Now, this type of necrosis is very characteristic, what we call as a caseous type of necrosis, where the tissue is completely destroyed. Unlike the more common type of necrosis we see in the kidney is the coagulative type of necrosis because of the when the blood supply gets cut off. In a coagulative type of necrosis, you can still see the cell outlines. The architecture is preserved. But in a caseous necrosis, there's complete destruction. You can't see the tubules, you cannot make out the interstitium, it's completely damaged. And on the picture on the right is taken from the region where the margin of the necrosis close to the viable tissue. And embedded in the necrotic tissue is, you can see these cells, elongated slipper-shaped cells, which are called epithelioid cells. There are some inflammatory cells and karyorectic debris. So a picture like this, we immediately do a special stain for acid-fast bacilli, and there were numerous acid-fast bacilli embedded in the necrotic tissue. So this is diagnostic of tuberculosis of the kidney. We often, this is one picture that I showed you of this case. Very often when we talk of tuberculosis of the kidney, what you think of is granulomatous inflammation. And yes, that is the most common pattern that we see. Formed epithelioid granulomas, bulging giant cells. And these are the Langhans types of giant cells where you have peripheral rimming of nuclei or a horseshoe-shaped nuclei. And this is the characteristic finding in a patient with a good immune response, whereas my patient was an immunocompromised patient whose immune system couldn't develop or produce this sort of a granulomatous reaction. So now, what are the different types of granulomatous reaction? In textbooks, we read that it is drug-induced granulomatous inflammation that is the most common cause, but in India, it isn't so. For us, it is tuberculosis, which is the most common infection, and it usually presents with subnephrotic proteinuria and a raised serum creatinine. But acid-fast bacilli are demonstrated only in 10% of the granulomas, as per the study from a large center in the northern part of the country. And necrosis